Back pain series, physical therapist or personal trainer. This article is possibly the most controversial article I may ever write. And I run the risk of getting hate mail, but my blog is all about cutting through all the hype on health that is running out of control on the internet. Especially since the economy took a downward turn 5 years ago, more and more people are trying to use the internet to make money, and I can appreciate that. My long-term goal is to have a virtual health clinic, essentially, so I understand the desire to create an online venture. The only difference is that I have a solid formal education background and credentials. The internet doesn't verify credentials when people position themselves as an authority on a given topic. My patients will usually ask me about their ongoing fitness once they are discharged from my care. And after I educate and encourage them to continue with their lifelong endeavor of physical fitness. Should I work with a personal trainer at the gym? This question lends itself to an issue that I find widespread in the health and fitness industry. Personal trainers are working with clients who have been diagnosed with various diseases ranging from congestive heart failure, diabetes, chronic kidney disease, spinal stenosis, and so on. Now, I realize that personal trainers may be reading this post saying, "That's not me, I know what I'm doing and can safely help my clients." Maybe so, but how is the consumer really to know this? There's no minimum competency assessment and assurance process. There are dozens and dozens of personal trainer certifications out there. No governing body has established a universally accepted standard of education and knowledge base when it comes to personal training. A personal trainer does not have to be licensed by a state government to operate. Essentially, it is a buyer beware scenario. You, the fitness consumer, must do your due diligence when hiring a personal trainer. But how do you choose? What criteria should you consider? No, this personal trainers are not the same as physical therapist. The problem, again, that I see with the personal trainer industry is that there is no standard universal education process. There are dozens of certification entities. In contrast, in order for a physical therapist to work with you and perform physical therapy management and call it physical therapy, he must be licensed by the state to practice within that state in which he would like to practice. To be eligible to be licensed by the state to practice physical therapy, the physical therapist has to sit for a physical therapy board examination. And the only way to do this is to successfully have graduated from an accredited physical therapy program. The last 10 years has seen the physical therapy education progress to an entry-level Doctor of Physical Therapy, DPT, degree. In 2001, all PT schools were mandated to offer no less than a master's level degree, and most schools updated to the DPT. As of January 2016, all point schools had to now only offer the DPT. Before 2001, many programs offered the BS degree, 4-year, in physical therapy with a MPT as an option only. So the entry-level DPT graduate is still the minority out there in the field and will likely be for another 10 to 20 years. Many DPT majors, pre-DPT, in undergraduate degrees are exercise science focus, but can still be psychology, kinesiology, biology, physiology, and other health-related sciences. There is extensive didactic, classroom, time as well as clinical time spent learning the physical therapy skills and practice with the entry-level DPT program being 3+ years in length on top of a 4-year undergraduate requirement. The DPT program I graduated from even merged with the university's medical school for several basic medical science courses in the first 2 years of the DPT program. So for specific courses, my program had the DPT students taking courses along with medical students. This is not the standard in DPT education, but I believe it should be, as I received a tremendous education of the basic medical/health sciences. We of course had our own DPT coursework as well that was independent from the medical school. The point I'm making is that by the time the licensed physical therapist is eligible to practice in a given state, You the public can be certain that he has a minimum level competency in which to practice safely and effectively. The same cannot be said for personal trainers. A personal trainer can become certified by having a high school diploma and taking a home study course. With a test at the end, the test can be completed by mail-in or online. Some certifications actually make the candidate test at a testing center, so that's good. But a home study certification for me is not the same as a 4-year degree. My outline to help you choose a qualified personal trainer is as follows. Always confirm with your healthcare provider that you are healthy enough to participate in a fitness program. If you are symptomatic or would like to know biomechanically efficient exercise strategies, a specialist like a physical therapist is ideal. If you choose to consult a personal trainer, then look for one with at least a 4-year BS degree in exercise science or related field. The fitness certifications aren't as important to me because they are not as qualitative as the 4+ year degree in exercise science. Again, there is no certification standard that our society has put forth. If you choose a personal trainer that does not have a 4-year exercise science-based degree, then I would recommend choosing a trainer certified by the American College of Sports Medicine, as they have a health fitness specialist certification which requires the individual to have at minimum a bachelor's degree in exercise science, exercise physiology, or kinesiology. Again, my opinion is that even this certification does not take the place of a physical therapy education. When working with people who are symptomatic or experiencing disease processes, it is difficult to discuss every point about this topic in this post, but I hope I have been able to outline for you several major concerns I have on the matter and further outline options for you, if you were indeed trying to make a decision for your own fitness needs. This post is intended for consumers who are researching information on this topic to help them make informed decisions. If you are a certified personal trainer and have negative feedback on this post, then I encourage you to send me constructive input, as I'm always open to professional, helpful conversations about different viewpoints. But before doing so, please take a moment to consider my point of view. You may be ethical and truly know your craft, but you are the exception and not the rule. The consumer needs to be better protected from your peers who do not possess the skills to be working with fitness clients, and particularly clients with active disease processes. Thank you for your time today. See you next post. I'm wishing you healthy living. Dr. J. Herrera, DPT. Thank you.